Cardiac diseases in pregnancy which have major risk of maternal mortality are pulmonary hypertension, aortic coarctation with valvular involvement. Pregnancy can be terminated at any gestation if the fetus is diagnosed to have anencephaly. Which one of the following is not a cause of recurrent spontaneous abortion? Rubella infection. The congenital abnormality which is invariably lethal is anencephaly. For vaginal breech delivery, ideal selection criteria would include fetus not compromised, adequate pelvis, extended breech presentation, estimated fetal weight less than 3.5 kg. Consider the following presentations. In which of the above vaginal delivery is not possible? Answer is bro presentation. The blood supply of uterus is from uterine artery, ovarian artery. Which one of the following regarding amniotic fluid is true? It reveals information about fetal lung maturity and well-being. Consider the following statements regarding changes in pregnancy. Plasma volume level increase up to 30-50%. Pregnancy is hypercoagulable state. Hematocrit is decreased. Total plasma proteins increases. Which one of the following statements regarding anatomy of fetal head is not true? Lambdoid suture separates the two parietal bones. A 30-year-old lady, mother of 3 children, presents with mass descending per vaginum. On examination, it was found to have stage 3 prolapse, moderate cystocele, no posterior vaginal wall prolapse. The recommended surgery would be cystocele repair and Manchester operation. A 50-year-old postmenopausal woman comes with complaints of bleeding per vaginum. Which one of the following investigation is not required? Diagnostic laparoscopy. Which one of the following is not an emergency contraception method nor plant? All of the following statements are correct about vasectomy except it increases the incidence of testicular cancer. Which of the statement regarding anemia in pregnancy is not true? If mother is severely anemic, the fetus is also severely anemic. Which one of the following statements about male sterilization is not true? It is performed under general anesthesia. Which of the following is not a method of second trimester abortion? Intraamniotic KLC instillation. In the process of MTP, medical termination of pregnancy, done by suction and evacuation, it was realized that perforation of uterus occurred with cannula. The next step should be laparotomy with exploration of bowel. Consider the following statements regarding MTP, medical termination of pregnancy. Suction and evacuation can be done up till 12 weeks. Cellulitis is a non-suppurative invasive infection of tissues. Following are the factors for increased risk of wound infection except good blood supply. A 25-year-old lady underwent exploratory laparotomy for bowel injury which happened while she underwent medical termination of pregnancy 2 days back. 24 hours after exploratory laparotomy, her pulse is 106 per minute, respiratory rate 26 per minute, total leukocyte count 14,000 per cubic millimeter with blood urea 84 mg% and serum creatinine 2 mg per deciliter. The lady is having sepsis syndrome. A 22-year-old young man came with history of occasional bleeding per rectum. On colonoscopy, numerous sessile polyps were seen in descending and sigmoid colon. On family history, his elder brother was operated for thyroid malignancy. The young man should be advised prophylactic panproctocolectomy. A 47-year-old postmenopausal lady was on adjuvant hormonal treatment with tamoxifen for 3 years for carcinoma breast. She came to outpatient department with history of passing blood clots per vagina. She is probably suffering from carcinoma endometrium. Which of the following regarding blood supply of rectum is not true? Middle rectal artery arises from external iliac artery and passes through the lateral ligaments into rectum. Gastric conduit after esophageal resection is based upon right gastroepiploic artery. A 70-year-old male having comorbidities present with benign appearing parotid tumor. The best option is aspiration biopsy confirmation. Fine needle aspiration cytology FNAC is not conclusive in which one of the following thyroid swellings? Follicular carcinoma thyroid. Patients with phalbographically confirmed deep vein thrombosis of the cuff are at the risk of significant pulmonary embolism.